So Karen, are you in Florida?
No, I'm in Indianapolis.
I thought your family was from Florida.
Yeah, they are, but my mom is in Indy, so we're like
Yeah.
random.
Yeah, I'm original from Nigeria. My mom is in Havana. So,
All right. So
Yeah.
random, right?
I'm from Danville, which isn't as exciting as Nigeria or Florida, but I'm in the Champaign City building at the moment. Checking sound, so y'all hear me right? We're good?
all
Okay.
thumbs up for that.
All right. Good to see everybody.
And should I plan to present?
Well, it's up to you. I have the board packet, which I'll put on the screen sometimes, but I think if you have a presentation, it might be easier for you to manage it.
Okay, all
If
right.
you'd rather me do it, I can sure do it, but I might not be as fast as you, you know.
No,
when
I
you-
think I can manage.
Okay,
Okay,
and
what-
just let me know if you want to change it.
just say when.
Okay. Yeah, we have just a little tiny bit of business prior to the presentations, which are really approval of the agenda and then any citizen input. And then Joe might make some comments.
Hello, I'm here.
Hi, Susan.
We have,
I'm gonna have to leave at 7. I'm really sorry, but I've got another appointment.
oh, dang.
Sorry.
Well, you know, we could, let's see, we've got,
It's recorded.
yeah, you don't have quite a quorum,
We
but
don't have quorum yet.
here comes Matt Hausman, so now you have 4
Oh, that's good. I'll
happening
be right
fast.
back.
Okay.
Okay.
So with one other board member, you can start.
Get started.
I'm moving.
And here is the 5th board member. So she's
Yay.
coming in now. All right.
Oh, let's leave 1 minute because it's 5:44. So we got.
We've got 2 more people coming in. So yeah, I think you
Good.
can call it if you want to.
Yeah, let's go.
All right.
Call to order.
Yay.
Stephanie, go ahead and do justice.
Susan Fowler,
Here.
Matt Hausman,
Here.
Daphne Maurer, Elaine Palencia,
Here.
Kyle Patterson, Julian Rappaport, Jane Sprandel. Here. John Paul Joachim, Joe Omo-Osage.
Yeah, I don't know if you heard Julian's here.
Yeah, I just unmuted. I'm here. Thank you.
Okay, approval of agenda. Agenda.
Here is the whole agenda.
Report. It's all. Approval. So we have to vote on this, so we just move on.
You could call for a motion to,
Okay. With motion to approve the agenda, please.
I so move.
I'll second it.
Favor?
We have to do a roll call, I'm afraid.
Roll call again? Okay.
Matt Hausman,
This one should be-
Yes.
Daphne Maurer,
Yes.
Elaine Valencia,
Yes.
Julian Rappaport,
Yes,
Jane Sprandal,
Yes.
John Paul Yoakim, Susan Fowler,
Yes.
Joe Omosage.
Yes. So citizen input or participation, anybody where you are, Lynn?
there is no one here. And all the doors are unlocked. So as soon as the presentations start, I'm gonna go lock the doors.
Sounds good. Any citizen participation in the Zoom call right now? So if there is no one ready to say anything, let's move on to the next thing. Quick comments. I mean, I'm ready for this presentation. But before-
excuse me, Joe, would you mind doing whatever you do to make yourself more clear on your microphone?
So I'm not playing in today.
It's to me, it's very fuzzy, so I having trouble making out what you're saying.
Oh, okay. Okay, I'll just lean into it this time and see, turn it up. Can you hear me now better?
A little better, yes.
Good. So my comments are very limited, saying, hey, let's get this started, and looking for the presentation that's happening, letting us know what's going on in the community. These are things that will make our community better as we deal with more and more trauma, and we need more information on how to deal with it. Okay. So it's the study session. So we have in the study session the Coalition Community Violence Response Team, and the presenters will be Karen Swim. So we'll start off with quick introduction. Experienced consultant, trainer, facilitator, coach. She has a master's degree in marriage and family therapy and has spent over 30 years advocating for individuals, families, and communities who have been marginalized by race, gender, sexual orientation, identity, health, or socioeconomic status. She is the founder of Trauma Resilience Initiative Incorporated and is a not-for-profit that trains, educates, advocates for and promotes resilience and justice for individuals, for families, organizations, and communities. TRI works to reduce the impact of adverse community experiences by healing and repairing those who have been impacted by trauma and equipping organizations and providers by trauma to be trauma and justice informed. Karen has expertise in trauma-informed care, cultural responsive practices, community engagement, outcome-based planning, collaborative processes, and implementing evidence-based practices. And she will be joined by Mary Catherine Robertson, the mother of three from Danville, Illinois. She's a community organizer around civic engagement, racial justice, and gun violence prevention. She worked in education in Danville for several years, full-time as an after-school program coordinator for middle school age students and part-time at a Danville Area Community College, teaching English as a second language and U.S. citizenship to students from all over the world. Mary Catherine currently works as a community relations specialist for the City of Champaign Office of Equity, Community, and Human Rights, and helps to address community issues such as community violence, community engagement, police community relations, and youth development. Am I still clear? And Regina Kreider, the founder of Youth and Family Alliance, or the Alliance, has served as executive director for 6 years. Before acquiring her current role, she worked as an advocate for youth and families for more than 15 years across various and child serving systems in Illinois. She's a statewide trainer and national speaker for children's mental health issues. She serves as a vice president of the Family-Run Executive Directors Leadership Association, the director for Illinois Children Healthcare Foundation Board, and a newly appointed by Governor J.D. Pritzker to the Illinois Children's Mental Health Partnership. Regina loves serving her community because she can relate to the day-to-day struggles that all families face. Recently, she was elected to the Village of Rantoul Board of Trustees for District 2. Our presenters. Okay, who wants to start? Karen?
So, hi, welcome. I'm going to start our presentation and we'll get going. I'm just always super impressed with how amazing Champaign County is with all of its great resources. So while I do this, Mary Catherine, do you want a small talk? There we go. Here we go. So as many of you are aware, Champaign County has had a number of incidents of shots fired and gun violence this year. And Mary Catherine, you can add and contribute because these numbers were from early October when we sent in the PowerPoint, and unfortunately, the numbers keep evolving and changing. So from year to date, there were 182 confirmed shots fired. There were 4 murders between July and September. In Urbana, there were 80 confirmed incidents on average of a shooting a day, with 2 murders between July and September. Again, those numbers have increased since we put together the presentation. So, Mary Catherine, is there anything else I should add here?
I would just
about
update. I had gathered the most recent numbers I have were 205 shooting incidents, and we are at 13 homicides, unfortunately, in the city of Champaign.
And so I will sort of say something parenthetically. So as you are fully aware that there's an intersection between gun violence and COVID, what we are experiencing in Champaign County is reflective of the things that are happening across the United States in communities big and small, where there has been an increase of gun incidents that have been coincided with the COVID crises. And people have a lot of hypotheses about why and the etiology of that. And there have been lots of conversations about why that exists. Some of the things that people are aware of is that one of the things that happened as soon as we moved into COVID, where there was an increase in purchases of firearms, and where there's an increase in guns, there is an increase in gun violence because people have more access to guns. And then when you contribute the stressors, both economic and social and mental health stressors that have impacted communities who have been historically vulnerable, it's just been the powder keg of violence. And am I missing anything? I'm going to look to Regina and Mary Catherine because I don't want to. There could be pieces that I'm not filling in. Okay. So what's being done, and Mary Catherine, if you want to add to this, so you want to take this over?
Yeah, absolutely.
Okay,
so in terms of what's being done, so we have a 4-pronged approach that we're using to address community violence. The first being the victim and family supports that you'll hear more, about some of those direct supports that are offered through the community violence response team, through CU Try, and also through some targeted programming with Champaign and Urbana youth males. Who have shown, maybe a need for some additional support or some previous history involvement with the juvenile justice system. We are also working with some neighborhood community supports through neighborhood safety meetings, community violence response forums, We have lots of virtual and in-person events to gather information, strategize, discuss solutions with community members. We've done public messaging campaigns trying to elevate the voices of the youth and folks who are impacted by community violence, as well as a partnership with Crime Stoppers to try to encourage people to report incidents that they see anonymously if they do not feel comfortable sharing with law enforcement. Although, of course, we encourage folks to share what they see with law enforcement, and just working to strengthen community partnerships throughout organizations. Our third prong is support for the formerly incarcerated. So that's through our CU Fresh Start Focused Deterrence Initiative, which works directly with individuals with a history of involvement in gun violence, providing them supports and resources if they are willing to stop engaging in gun violence. And of course, that's also a partnership with law enforcement, because if they do not stop engaging in gun violence, then of course, the law, then they will need to be incarcerated, right? And then we're also on the Champaign County Reentry Council, and we also support the work of First Followers, which is a local organization serving formerly incarcerated individuals. And then finally, we work with the local law enforcement, Champaign, Urbana, U of I, Parkland, to just coordinate activities, make sure we have representation at various block parties and community engagement activities to help strengthen that community relations piece, or police community relations piece.
So I don't think everybody knows, but we have this broad and deep community violence response task force, which might be confused. And I'll let Mary Catherine explain the countywide council, because people have been confused about the two. But the task force, actually, Tracy Parsons created this about 3 years ago around this time as an effort to bring people who were engaged in community violence work together to think about a coordinated response. And so TRI has been at the table, but there are a variety of different representative voices that pop in and out of the group. Literally a lot of the ideas that we've come up with or tried to do have come from this committee. And this is the group that sort of looks at the surveys from the neighborhood meetings. We also share that with local government and law enforcement, but always is sort of taking those conversations and reflecting and chewing and thinking about what can we do different, what can we do better, how can we respond. Am I right? And I know that there's a county-wide council, and people sometimes get confused. And I want to share that we've sort of switched up this year. So this is one of the things that we're going to announce tonight that we're talking about, is some redirection that we did when the county council got put together. So Mary Catherine, can you say a little bit about that county council?
Sure. We do have a countywide coordinating committee that we formed back in April, and it was kind of we had a steering committee for CU Fresh Start, and we really wanted to make that a larger community conversation versus just that one, versus just overseeing that one initiative. So the coordinating committee is a hub of resources and information. It's where we talk about the history of addressing community violence. We also want to elevate the community voice as we promote our initiatives to address community violence. We do host facilitate community input as we devise messaging strategies and things like that to include the community voice, also identify community resources, and work to kind of bridge those silos of all the different partners that are doing this work. Now, there is, as you can hear, a little bit of, there's some similarities, but they are different entities, and the CVRT role is more direct response, those neighborhood mobilizing, direct outreach, door-to-door efforts in the community on the ground, and that is where we are distinctly different in roles. So one is siloed, kind of trying to collaborate. Well, they're all collaborative affairs, but the CVRT is more that direct on the ground, door-to-door entity.
And so when the council, so always the vision was, so Tracy Parsons sort of initiated some of this, and he always had this wish that we would move from sort of an individualized approach to more collective approach. And this summer, he actually starting in April, when the county-wide council got put together, he asked some of us to come together to rethink. He came to the community violence response task force and said, let's rethink what you're doing. In part, there was some feeling of overwhelm doing both capacity building and coordination and direct service. And so we were always adhering to system of care values. And so through a lot of different conversations, we decided to sort of divide and conquer. And as a result, and we've been sort of piloting it. So I want to tell you, this is what we're talking about, is what we're doing, but also some piloting transformation. Is that we decided that a lot of the neighborhood building, community building, sort of macro stuff would Mary Catherine and the city would take some lead in coordinating and facilitating that. And around the direct service piece, TRI and the Youth and Family Peer Support Alliance would partner to do some of the direct service for survivor support. And then TRI would continue to provide some administrative support in collecting data, doing survey analysis, in the training. And so we sort of split up just to increase bandwidth and capacity, because we were all kind of feeling like we were moving in 13 different directions. And so this is always the vision, just so that you know, every time we're at a neighborhood meeting, people always go, well, you should be doing, and we're like, well, we're trying to do, but know that what we know is that there needs to be, based on all research and science, and we have all spent a lot of time investigating this, so this is not us making it up, that there needs to be solid prevention. So if people show up in meetings and they're like, why can't we stop shootings? We ask, what are we doing around prevention? What are we doing around intervention? And where are we around postvention? And our community violence response task force, notice, it's responding to violence, not preventing violence. It is not necessarily intervening with violence. Those are two parts of the system that do not exist and are not well funded or supported right now. So, right, like that's the transparency. We do postvention. So unfortunately, there is a lot of prevention that needs to happen and a lot of intervention that needs to happen. We are trying to think about ways that we can add more interventions after a crisis, so more psychological first aid and more emotional support in neighborhoods and communities. And we think some of the capacity building that the neighborhood meetings are doing are part of that intervention, but those aren't the evidence-based interventions that we know need to exist in communities that have been impacted. So I will do a couple little talking points. I want to just tell you a little bit. No, actually, this is Mary Catherine's slide. So Mary Catherine, it's you.
All right, and I can't see the slideshow anymore, Karen. I'm assuming we're on the neighborhood, community building, neighborhood safety meeting slide, and I don't know if that's just my view. Okay.
Yeah, yes.
It's just
so we're on
interesting.
the 22. Yeah, we're on the 2020 Community Violence Response Task Force Successes. Yes.
All right, and I have it right in front of me. Yeah, so we have been hosting these neighborhood-based community violence response task force meetings in Champaign and Urbana, alternating. And so since we have started them in 2020, 55 individuals signed up for the task force, and of those 20% are community members. And so we've held two community violence response meetings. So those are in the immediate aftermath of an incident of community violence. And we also held 4 neighborhood safety meetings, and those are in areas that we know have been historically impacted by community violence, but they're the neighborhood buildings, spaces where we go and try to strategize with the folks who are impacted, devise solutions, and then help get those solutions implemented. And so we have had 315 adults and 32 children reached in those spaces. And we've also formalized a partnership with Carl to assist in our community violence response plan through the emergency room departments. Oh, I'm sorry. And then 8 people have been cleared as volunteers. And so so I have the printout here too, Karen. Sorry, I'm just not sure why my screen isn't lining up. And so just a little bit more about those community building neighborhood safety meetings. We always talk about building relationships, strengthening trust, And so that's a part of what we do when we're out in the neighborhoods. And so I've shared before that they are monthly and on a rotating basis between Champaign and Urbana. So these are spaces that people can talk about their needs, find out about resources as it relates to community violence, addressing trauma, healing, and resiliency. It's also a place where we're able to share information with people in communities, because we regularly hear, like, we didn't know you were doing that. We didn't know that was happening. So being present in these parts of the community to share what is going on to help combat, kind of that idea that nothing is happening, and also, to share resources, share where folks can get help, and engage and empower the community to address this, right? That it's not just something that's got to be city-led or systems-led, that the people who are impacted also have a strong voice and ability to address it. And sometimes they just don't know where to start, and of course are overwhelmed also. So that's where all of us working together in that collaborative effort is really needed. And so at each of these meetings, we do neighborhood needs assessments, neighborhood strengths. We talk about resources so people can share, and we can track, to Karen's point about the data, track very directly on a neighborhood by neighborhood basis what people are saying they're seeing, as well as what people are saying that they're needing. And I'm so sorry. I'm so sorry I can't see the screen. So I know we have some pictures from neighborhood safety meetings in Champaign and Urbana, including our most recent ones at the Legion and at the Leonard Rec Center, which was in the aftermath of a recent shooting of a young man. And these are held, community members can call. So we'll share a number, I think later on in the slide presentation. And sometimes people will call me directly, or they may call Karen directly. But when we get that community concern and need for us to respond, for the CVRT to come out into the neighborhoods, that's where it's important that we have a broad swath of volunteers and folks that we can call, because sometimes these meetings are planned within, we always try to have them within 72 hours. Sometimes they're 48, but they happen really, really quickly. So it's important that we have a nice number of volunteers to call on for facilitation of those meetings. We provide childcare of people so people can bring their kids. We provide food. So everything from, serving food to tracking data, there's lots of roles for folks to help there. So I guess I spoke a little bit about the Community Violence Response Forum. So those are so that's like the one we just spoke about, where there was a young man killed and we received those calls to come out. And people can share how they've been impacted, find those same resources, and also if there's any information to be made immediately available after the incident, we use that as a space to share that, and also ensure that there's city staff there, that we can get law enforcement there as they're able to be there, recognizing that they're extremely short-staffed right now. Also, to share relevant and pertinent information to community members and people who are impacted.
And just so that, because we want people to know, the community violence response forms, anybody can call one. People have had critiques about when we have them and not, because we said we would do them after incidents of significant events. But typically when we do them, they've been initiated by the community. So we just want to know, we want people to know that anybody can call them. Because that's important. So on this slide, and then I'm going to get to some specifics and make room for the Youth and Family Peer Support Alliance. We just want you to know these are currently just the resources that we are aware of to support survivors. We could probably add some. There are some programming that happens through DREAM and the Well Experience and HVNT, but HVNT does a lot of grassroots. They do some intervention and some like early intervention, prevention, community building activities. And DREAM has done some targeted supports. So there are a few more things that we could be adding to this, but notice it's given the number that we showed you of shooting incidents, the opportunities that we have available are not definitely enough to meet the need. So I get a chance to talk about our community violence response model, and you have a handout. So I know the slide is not clear, but I want to explain what happens when people are what happens after an incident of gun violence, with a couple of caveats. One is that we have heretofore not had bandwidth and capacity to serve everybody who's been impacted by gun violence. So, and I'm going to say some things that are probably right. So we're going to walk this through. So we tend to respond to folks who call us, respond when people make a referral. We don't proactively seek out survivors. And I know I wish we had bandwidth and capacity, but I want to just give you a sense. So just this week, we've had 3 calls for support, and that's without us promoting, reaching out, or any of those things. We had a period of time this summer where there were 12 different families representing 40 different people who came into our, pathway needing help, and needing help needs a bunch of different things. So I want to explain what happens. So people call us. A phone number is 217-673-7122, or they email or text, or Carl makes a lot of referrals to us. And what we do is we sort of triage, and I know that's not a popular word, but what we do is we listen well and see what the needs are. Sometimes it is simply a listening ear, a texting conversation, or just knowing where to go. So sometimes it's a very simple shift to do that, because a lot of times it's really like answering questions. That phone is staffed 24/7, so people respond to it all the time, 7 days a week, 24 days, 365 days a year. We also have a phone number that is just for youth, which is our Here For You support line. And that phone number is also staffed 24/7. But with some volunteers and some dollars that we use for our mental health support network. If people come in and they need help, we currently now have a part-time person who is helping do some of the screening and assessments. So she's using a version of the CANS, which is the FANS, which is the Family Needs and Strength Assessment, and a sort of a strength and needs discovery. I know this is sounding way technical, but really we're just trying to hear what's going on and what needs are going on, but also seeing how we can best respond. And some people come in based on their needs. They sometimes only need crisis support. And if it's crisis support, we get in, we maybe provide temporary housing at a hotel, or maybe hospital support, or maybe we're helping take care of the kiddos, or sometimes it's a comfort and care basket, or sometimes it's a listening ear. So we get in there, or sometimes it's a referral to therapy, or sometimes it's connecting to like mentors. And sometimes, so when it's easy, we connect people to those services, we provide those services. When it is a little bit more complicated, and we are assessing this, if they already have a care provider, we're trying to connect them back to their care provider to be the primary source of support. If they are, and sometimes, so we do a lot of bridge building. So if it's a school social worker or whatever, I know this, and if they don't have anybody, or they don't want to work with those people, and sometimes we get that, then we work with either, so if it's a family with youth under the age of 24, and they want and need more comprehensive support, we connect them to the Youth and Family Peer Support Alliance. And when there are young adults or mommies, we as or daddies, we take the lead in supporting them. And support can take on a number of different ways. We use people from our mental health support network, our Support For You network. We as staff help out. What we tell people is that we will provide you 16 weeks of support. I don't think we've ever just provided 16 weeks of support, but what we say is we can provide you 16 weeks of support, just trying to help you navigate. And so I can just do a couple little stories, and then I'm going to go to Regina's slide, so everything from, and I'm trying to use as much de-identified information as possible because we're in a small town. And so many of these stories will sound familiar, but we, will help people find new housing. That's one of the biggest issues, is moving people into safe and secure housing. And we really do this as a collaboration. So I will tell you, for example, Youth Bill frequently will come in and help us pack up people. First Followers will drive the truck and will physically do the labor. We might get volunteers from Moms Demand Action or Bend the Arc to do comfort and care baskets, or help provide furnishing, or help buy curtains, or maybe be with the kiddos while the move is happening. It is literally the village coming together, all mobilized. And as you can imagine, it's a lot of moving parts. We keep an active volunteer list where we're sending messages constantly saying, hey, we got this family coming in that needs X, Y, and Z. Can you give? And then sometimes the needs go away or they compound, and we're constantly mobilizing all the moving parts. So that's how this works if they come in. And so, Regina.
Thank you, Karen. I appreciate it. So thank you. So I just want to tell you a little bit about how we partner with the response to the community violence, as Karen stated. Those families that needed a little bit more additional support, more comprehensive support, that have youth involved up to the age of 24, we will come in and provide peer and family support. And our program is the Peer and Family Connections Program. And with that, the peer, which would be a parent, would get one-on-one support with another peer supporter. They'll be linked up to just be there for them. And you'll learn a little bit more about peer support in our next presentation. So I don't want to give all of that good stuff away. So they'll be linked up with someone who will be there to support them, a person with lived experience, a person who has been in their shoes and can relate to them and what's happening in their situation. We work on providing some coordinating of services. As Karen stated, we will work together when necessary for families, connecting them with resources, providing like a wraparound type of support for them, bringing providers to the table as needed. Once again, when it comes to the family peer support connection program, it's about what the family needs. And that's what we primarily focused on. We look at social skill building and social supports, opportunities for families to get out. We might have some community type activities for involvement. And then also our primary is doing systems navigation with the families. And Yolanda might talk a little bit about this in our next presentation, but she does a phenomenal job as a peer supporter when parents are having to return back to courts. When court cases are going back to court, and she's able to accompany a parent and the initial what's happening, all of the emotions and things that are going on prior to returning to court, and how that's impacting the parent, and being able to be there to support them. And so we do that systems navigations with them throughout the whole entire process. And that's like showing up with them in those meetings, in those court hearings, wherever they need us to be. And then we also have groups that are specific to parents. We're working on developing a mother's survivor support group right now that hopefully will have launched by the end of the year, if not the first of the year. So that's a little bit about the Peer and Family Connections Program. Thank you.
So just so that you know, thank you. And so I'm just going to say a few more pieces just so that you know what we did last year. And this year has been far more complicated than last year. So last year we served like 14 people, 14 families with wraparound. So representing a lot more people than that, right? So we're talking families, and that means that we pulled together a team, coordinated the team, provided ongoing support for families. Referrals come from a lot of different places, and we make a lot of referrals to places. So no referrals kind of get redirected back and forth. And I mentioned some of the depth and breadth of the services and supports that we provide, but, just to highlight, so a lot of, we use psychological first aid and skills for psychological recovery as some of our core models. They're both evidence-based, really the best practices, part of the best practices to support people, but we also use a wraparound, so we were listening, we use high, not high fidelity wraparound, but all of Carl and Kathy Dennis's community building wraparound as our core belief around community building. And we try to make sure that every family member that we work with and support is connected to, again, need driven. But one of the things that we find for families who've been impacted by gun violence is many of them feel disconnected. They feel disconnected from their own families, from their larger community. And so that whole sense of belonging. And so we try to make sure that every family member and individual that we work with feels supported and cared for. And we try to do that in a really robust and responsive way. And so like if somebody, and I want to say Champaign is an amazingly generous community. So if we have found families, who are being discharged from the hospital, who need crisis housing and hotel stays, we have been able to do that, but we've also partnered with RPC and the township, the trustees off Champaign Townships and the trustees office to help us find immediate housing support. And we've had lots of generous donors who've covered hotel costs and other kinds of things, or who've, kind of created ways. So we could not do this work without the generosity of lots of donations. So most of our referrals, just so that currently come from Carl Occupational Health. Although our partnership is with the ER, one of the things that happened last year was that Occupational Health got our flyer and brochure. And as they continued to work with gunshot survivors, they kept saying, our folks should be connected to you. And because of COVID, the ER didn't call us, but Occupational Health did. And so that worked on to be a really nice partnership. So I mentioned our Here For You network, that's in your packet. That is our youth mental health support that is offered. Support for you, if you ever hear these words, are the people we use to help with our crisis response, either at Carl or in the community group. Those are those people who provide that on the ground support. And Mary Catherine, do you want to cover this, or do you want me to cover what's needed? I'm not sure if you can see. And I want to stop talking because I know Regina wants to talk about peer support, but
that's fine. And I actually figured it out. I've got two screens and it was only showing on one. And
okay.
Anyway, so we won't go through that, but yes. So as we talk about what's still needed, that improved coordination and collaboration, even, we still recognize we're still sometimes kind of working in silos. So trying to get folks together, resources regarding people and funding and advocates. So it's just important that we have this coordinated response. We need trauma-specific treatment strategies for individuals with PTSD. And I know Karen has spoken to that before, just as we talk about some of the individuals we deal with, some of our CU Fresh Start guys, you recognize that some of them have been so deeply traumatized prior to pulling that trigger for the first time, and trying to find ways to address that. More community-based positive skill building activities to improve relationships, trying to make the folks feel more connected to the community. Housing has been a recurring issue, getting folks both temporarily and permanently placed in the aftermath of some of these incidents. So, for long-term and short-term, for young adults who've been impacted by community violence and their families, definitely in need of more training opportunities. And I have lost my screen. Academic supports and career building opportunities. On the ground, full-time people who can identify needs, mediate, sometimes some outreach workers, interrupters, whatever they're called by different names in different places, but we definitely have more of a need for those folks to be on the ground with the population more regularly. And then that last one is huge around here, is hope, and just trying to maintain hope that things people are working together towards solutions, and that ultimately we will see a reduction in some of these activities.
So always we could use more people being involved in our task force, always, always, always. And we have been meeting at noon, at 11 o'clock on a Friday, and we've heard from people that maybe later might be better. So let us know if you want to be involved. If you have a group, let us know that you can help us with needs assessment. This is an artifact. And then also we could always use more volunteers. So thank you.
Thank you. Excuse me, thank you very much. Does anybody have any questions? I know we have another presentation coming up, but do you have any questions for Karen and Mary Catherine? Great, Elaine. Go ahead, Elaine.
Get unmuted. Yeah, I have a question. I'm just very impressed with what you're doing, especially that the different groups are coming together. And I was just wondering if the families of the perpetrators are coming across your radar. I mean, because we read about, retaliation toward some of those family members that really had nothing to do with the incident. And I just wondered if they have reached out or if they're part of all of this. Thanks.
So we say our words are families impacted by community violence. And so we serve everybody. And that's been complicated, right? So we definitely have individuals who are sometimes on both ends of the continuum, and so, but yeah, we are open to them all. So the short answer is yes, and we need far more folks. And just full transparency, one of the issues we've struggled with over the past year and a half is we've been great at getting people who want to volunteer and help, but it's been hard and challenging to find people of color who can get in there and help. And I think for the need for people to feel like they can belong and feel cared, sometimes they need to reconnect with people, again, people of color, Black-bodied folks, to sort of really humanize their lived experience, particularly for people who've been identified on the perpetrator end.
Thank you.
Julie, did you have a question? Go ahead, Julie. Go ahead.
I guess I'm following up a little bit on Elaine's question. You obviously know a lot of the actors in this terrible drama. What's unclear to me is do you have any, well, I'm not sure what you can say and can't say, so you ask and answer it however you want, but I'm wondering if there's any information about the kinds of things that you're hearing from the people who have themselves, I guess the perpetrators, the people who have done the shooting. There's some finite number of those people who are identified and they're in the community and they probably get caught up with law enforcement, and for legal reasons, I would bet they don't necessarily want to talk all that much to people except their lawyers. But I guess what I'm trying to grasp is if you are able to sort from listening to those folks, what do they have ideas about what might have prevented them from getting in a situation where they actually have to shoot somebody?
So I have comments, and I know Regina has comments, and Mary Catherine has comments. So my short answer is, unlike a lot of communities, a lot of our gun violence is personal and interpersonal. So there is a lot of affect regulation. Like I get upset, I see something on social media, and I respond. And so it could be you go date my girlfriend, or we get into, so there's a lot of interpersonal stuff. And so What folks have told me is they wish that there were more support so that when they are making those sort of impulsive decisions, they had more support beforehand, and they had people to call who were those trusted adults. The other thing that I want to say is we forget, from my experience, and I think I wrote a little bit about this in my end of the year report, we also need to think bigger and broader. Every single mom that we have supported, or girlfriend, so girlfriend of a person who's been shot or a shooter or mom, has all of them, when we do a family needs assessment, all meet criteria for having complex post-traumatic stress disorder, and all of their children statistically meet criteria for PTSD. And when this incident happens, this is not the first bad thing that happened to them. Many of them have been exposed to shootings all of their lives, so they are wired to want to shoot when things go on. And again, Mary Catherine will say, like, they tell us they would be much prefer to be found with a gun than without. And so until the community feels safer, folks will carry. And so we either have to reduce the the access to guns, or help make sure people, but we also have to do a much better job of treating them. And so many of them have been in alternative placements or whatever, and that trauma stuff has never been dealt with. And so, right, folks wired to shoot and then have access to guns and get upset and then shoot.
Thank you.
Mary Catherine, do you have anything to add?
Yeah, I guess really just to double down on what Karen said. So through CU Fresh Start, all of our guys, our shooters, or have been at some point. And, we've heard tales of abandonment from mom when they were 7 or 8. One of our guys was like, my mama left me in a bathroom when I was 8. Like, what do you expect me to do and be, right? Some of our guys, and I say guys because they all have been guys up until this point, but if we, women can be referred to or non-binary people can be referred to our initiative too. And then the idea, the resources that they wish somebody had gotten them sooner. They say, okay, you came and found me after I had a gun charge to offer me these resources. What are y'all offering to the younger population now to try to get in front of them before they come to see you? So that's, mentors, resources, providers, that community piece. And then a safe community, we're asking them to put the guns down. And we've heard many times, like, I can't put my gun down. There's people looking for me. And even if I choose to make a better decision today, they didn't forget, or my brother may be involved in stuff and they're looking for him, and I'm an easy target if they're looking for him, right? So even some of our guys, we've seen folks graduate. We were, so proud, they're doing so well. And then wrong place, wrong time, or somebody looking for them from something past, they're shot. And so it just kind of confirms in their mind, well, no matter what I do, I can't find my way out. And that's makes them feel hopeless. It's really hard and on the folks trying to do the work to uplift them, because it does seem sometimes like no matter what they try, they can't quite get out. And I'm not justifying or excusing some of these behaviors that are being seen, but as long as they feel they live in a community where people are out to get them, jobs, programs, mentors, that type of things, they still will feel like it's not enough.
Yeah. Well, my observation about this, which you all know more than I do by far, and I appreciate, first of all, I appreciate every single thing you've been saying. It's very clear to me that, as Karen said, we are in a community that has a lot of actors involved and engaged and caring about these issues. But I have to say that in the many years that I've lived here, I do not think that teenagers or young people or anybody actually are dealing with problems that are unique to this time, except that now there are too many guns available, too easily available. So people always got mad at each other. They always had fights with each other, but they didn't necessarily have a gun right there, and they didn't think everybody else had a gun. So I guess what I'm wondering, is there some way that we can, I understand unfortunately, the constitutional limitations that have been imposed on us by bizarre rulings from the Supreme Court, which I'll just say as an aside. But within that context, I'm wondering if folks like you are so deeply involved in this can help us to figure out ways that we can reduce the number of guns available to people in our community. Is anybody offering any suggestions about that? I don't think I want to blame the human beings for this alone. It's a crazy environment that they're living in when you can get a gun just by asking around. So anyway, I'm sorry I'm raving, but you know what I'm talking about.
Thanks, Julian. I mean, and probably any one of you can take that one, and might be the last comment so we would present it. So do you have any comments to add? Regina hasn't had a chance to say anything about this. Did you want to say something?
Sorry, I would just speak and I'm not law enforcement, right? But I'll speak on our partnership with Crime Stoppers. You know, there's an illegal gun bounty where they up the amount that they give away, automatic $1,000 if you turned a tip that resulted in an illegal gun being taken off the streets. And so that was something the coalition partnered with Crime Stoppers to try to get some of those guns. I know we don't have a law enforcement rep here, but Champaign Police Department at our last meeting said they had taken out something like 13 guns off of the streets that week. And so I do know that they're actively getting guns off the street. I can't speak to how many that is year to date. But yeah, and I can't definitely speak to policy or the Constitution, but that's just a couple, the gun bounty program was something that we tried to do to be able to get people to anonymously submit tips, say, hey, if we get a gun off the street as a result, it's not up to 1,000, it's an automatic 1,000. That's been moderately successful in that we have given away, I think, like $23,000 as a result of that. Still, that's 23 guns, and if there's 100 on the street, it's all relative, but just to share a little bit about what has been done.
Yeah,
thank you. I know there are several. I know Susan has to leave early, so I'll let Susan do some other comments, and I know John, but we would like to start the next presentation.
Yeah, I don't want to be redundant, but I have a 28-year-old son, and he lives in fear of being shot and is afraid to leave his apartment. And his friends who come over usually come through the back door because they're afraid as well. And it's the prevalence of guns, and anything we can do in terms of a buyback program or reduction of guns. I'm just so sad about how it's impacting so many young people in our community. And I'll leave it at that. Thank you.
I know there are lots of questions and comments, but let's go to the next presentation if that's okay. Thank you, Karen. Thank you, Mayor Catherine. And I know Regina is staying for the next presentation, but the next presenters, Yolanda Hunter, had to navigate the juvenile justice system due to some behavioral concerns with her two oldest daughters. Yolanda has been a strong advocate and supporter for her daughters. She believes that being a parent is the most challenging job and the most rewarding job too. Yolanda is the project director and parent peer support partner supervisor for the Alliance. She has a master's degree in science. She has a master's in science degree in training and development. In addition to working with people and providing support to other parents and women, she is a life coach and a motivational speaker. Yolanda Hunter. And Regina is still here, so. Go ahead.
I'm trying to get myself off of mute. Thank you, everyone, for your time tonight. We won't be very long, but we're going to talk about something that's really near and dear to my heart, which is peer support. A lot of folks don't know a lot about the Alliance because we're kind of tucked away over here in Rantoul. I'm going to try to share my screen while I'm talking here. We're tucked away over here in Rantoul, and when we were birthed out of the sustainability plan for Access Initiative when it was winding down, and so we came to Rantoul to recollect ourselves and to regroup. And so we have come into our own. So I'm going to talk to you a little bit tonight about our organization and what we do. Yolanda is going to start us off with talking about about peer parent support, and why that's so important for the Alliance and our child serving system. So you got to let me get my mind together, because I'm trying to put my screen up here and talk at the same time. So now I'm not have my divided attention. So Yolanda, do you want to go ahead and get started and about what we do with peer support?
Okay. Hello. Peer support is, well, the role of a peer support partner is a parent that has expertise around parenting children with social and emotional behavior. And this parent helps support another parent or caregiver to support them while they're dealing with children with social, emotional substance abuse challenges. Also, a parent peer support are also known as family support specialists, FRDs, which are family resource developer. We offer hope and guidance, advocacy, camaraderie for parents and for the caregivers of children and young adults. So we support parents who are parenting those children in those age groups, and also who are receiving services for mental health or substance abuse systems. A peer support provider walks with the parent along the side of the parent, one, because they have lived experience. So we are parents who have also navigated or have some shared experiences around navigating child service systems. And so we provide an emotional connection to people who have been there. There's informational and educational support for families. And also we help develop positive approaches with other agencies and families so they can address their day-to-day concerns around the needs of their family, and also for self-care. And that we are living proof that recovery and resiliency is possible. And this is just kind of like a quote that a peer support is someone who's clearly on the family side, and we prepare to stand by them, and whose actions are always consistent with this stance. So everything we do, we support the parents. A lot of times we find that the children, the youth, get a lot of supports, and then the family, the parent or caregiver doesn't have any supports. And so the family is left feeling, the mother or the father, whomever, the parent, the caregiver is feeling like, where's my support? You know, I'm doing this, I'm doing that. Oftentimes as providers, we're judging parents on their parenting style. If their kids are getting too many calls home from school, or they stole something out the store, or they've been arrested for something, then the parent is being judged on those behaviors. So we like to provide that type of support where families feel supported also, in addition to the youth. Some of the common services that we provide are information around whatever whatever system they're navigating, information and referrals. Also, we do refer to other people who, we don't try to do it all. So we will refer families to other agencies or other people who could provide them that additional support. We do have support groups for young girls. We got GLAM group, it's called GLAM, and then we have a P3 group, which we're rebranding the name of that. And that's a support group for parents that we have every month. Then we have our parent and training education. Around that, we do one of the main things that we do is how to know if your child have a diagnosis, and if they do, what do we do to help them navigate to get the supports and services that they need. We provide training around IEPs. We provide training around advocacy. So we try to equip parents, because if we equip parents, then they're able to manage their lives and the challenges that they're going through day to day, because we have given them the skills and the educational resources to do that. The main thing is system navigation. We help navigate the mental health system, child welfare system, education system, juvenile justice system, disability system. These are really large entities. And if you have a child that requires care above that of a normal child, then you need some help. If you have a child that go to school every day, do what they're supposed to do, and then just one particular day something happened, it can be they was bullied, or anything, and you have to go into that school and talk to that staff, that's going to be foreign because this is something that you have not charged. So we try to walk along with the parents to do that, to kind of help them understand what they can do, the do's and don'ts of those systems, and how to get the resources that they need to help their family be more successful and resilient. We help with crisis support, and that's not just, sometimes it require us maybe sitting in an emergency room all night, 5 hours with them until the crisis support team. It's also educating them on what a crisis is, what it looks like. And also if the kid coming home and he's, throwing TVs off the wall, that might seem like a crisis, but that might be a way that we can solve that by maybe calling the police. If the kid is just too out of control, then calling 911 and say, hey, I have a child with mental health concerns. Could you please send an officer out that's trained to handle children with mental health? So just educating on them how to handle crisis support, recognize when it's a crisis support, and then helping them build a plan around further handling crisis supports or challenges that may just be episodes that they can manage if they learn, because crises are things that adults don't know how to handle. So we want to make sure we educate our families around that. Wellness. We do we recognize Children's Mental Health Awareness as a yearly event in May. That's a national event. So we also do a lot of awareness around that. We make sure that people don't feel stigmatized because their child has mental health. We don't want to make it like, oh, this is normal. I wake up, my kid has mental health. But that the reality of it is that we do have, are you switching the slides?
No, go ahead.
And so we do that, and we provide social activities for families, because oftentimes the families that we serve do not get to participate in a lot of social activities. So all our activities are designed to be socially, emotionally available for families, so that they are not asked to leave because they can't manage their child. Peer support happens everywhere. Mental health agencies, family support organizations, schools, child welfare, juvenile justice, which are mostly the child service agencies that we are aware of. It happens in communities, at work, where families live and work, and that's connected in churches and where they live. So it can happen anywhere. It's not, they don't have to come to us and get support. We go to them. We try to follow our parents on what we call a parent support journey. And so they can be anywhere on this continuum. And these words are very bright for me to see. So the first impact is becoming defined by the situation. Something has occurred, family doesn't know how to manage it, that situation starts to define them. But as we begin to work with the families start to move across this continuum till they are at the point where they are not only advocating, they recognize they're in the system, they're advocating for their child, they're advocating for their family, they have been activated to do something to make a change. And then once these families are even more activated, they are ready to help support other families. Our workforce come from the families that we serve. So we work ourselves out of jobs by hiring more people into these jobs. So that's kind of sort of how that is. And they can be anywhere on this continuum. And if they have more than one child, they can be at the end with one and back at the beginning with another. Regina, do you want to add anything to that?
Yeah, so what I also want to say about the parent journey, so just to kind of show you how it works, I can tell you a little bit about my story. Everyone that we hire at the Alliance are parents with lived experience, meaning that they've done that systems navigation. So just to show you how the parent journey work, I can tell you a little bit about my story with my lived experience. So become defined by the situation is the day that I got the phone call that my daughter tried to hang herself in the bathroom at school. And from there, I got on the fast track of beginning to look at how to get her the supports that she needed. There was about 6 or 7 months in between there, and I'm working with the school, I'm talking to her doctors, and I've finally come to the conclusion that I have to do something to really help her, right? I have to act. And so that meant that I needed to get her an IEP because I did not want her to be in special education. I was doing everything I can to avoid that system. But I had to come to the realization that only that I was a part of a system, but I needed to act for her to be able to get what she needed in order to be successful in school, because that's where she had a lot of her challenges take place, was at school. And so over the course of from fourth grade all the way to her graduating from high school, it was a constant ongoing battle. I was just sharing with a parent today that I was supporting that when the first quarter of her 7th grade year, she didn't go to school. She missed the whole entire first quarter because she has extreme school social anxiety. She didn't like school. She hated school. She didn't fit in. It was just all of these things. But in the end, now that she's getting ready to turn 22 next month, we've transitioned from children's systems to the adult system. She's still a young adult. She still needs support, but I understand the meaning behind it. And that's why I'm so passionate about what I do. That's why I'm passionate about providing support to parents, because I want parents to know you can do this, right? You don't have to give up. I know it's tiresome. I know it's burdensome. I know you don't understand it or get it. You know how always they say, oh, kids don't come with a manual. Well, kids who have mental health problems definitely don't come with a manual. So you're just really trying to figure it out second by second. And I was telling this mother that I was supporting today, she was like, Regina, I'm just tired. She was like, I want the best for my daughter, but I don't know what to do. I said, that's what I'm here for. That's what I'm here for, is to let you know you can do it. I said, look at my daughter, she's getting ready to turn 22. We've been through hospitalizations. She's jumped out of cars on the highway and been taken to, picked up by the police. I've had DCFS at my house, you name it, we've experienced it. And that is where that connection comes in, is there is somebody who has walked in my shoes who get it. And so that's what's really beautiful about the peer parent support, the journey of the peer parent support. When we do our services, we use a model called Pearls. And we're not just advocates. We are actually coming to the table to create a peer-based relationship with the parents that we are supporting. So it's not that we're up here, we're the experts, we know more, we're leading you along to tell you what you do. No, we're coming alongside you to support you in your decision-making of what's best for you and your family. And so this just gives you a look at our model that we use. This is what we train our peer supporters in, that we're developing a peer-based relationship. We're encouraging parents to grow. We're not making decisions for them. We're not telling them what to do. We're supporting them by actively accepting their decisions. I may not agree, just like if I'm talking to my friend Yolanda, I may not agree with the decision that she may make. She may decide, Regina, I want pink hair. And I'm like, well, I don't think pink hair is the greatest, but if you like it, I'm supporting you in having pink hair. But these might be some downfalls to getting pink hair. People might look at you funny, or your hair may come out. I don't know, but I can still accept her, right, as my peer, but I can still share with her what some of the challenges that she may have by making this decision. That is the beauty of a peer-based relationship, is that there are times we can say things that other service providers may not be able to say, because we are right there with them. We come to the table with a high degree in regard of respect for the family. I explain it like this when I'm training. As peer supporters, when we enter into the life of a family, we're entering into their sanctuary, their sacred place. And so it's for us to come and sit at their feet and humbly learn about them and what their needs are, so that we can support them. And when you come in a place of humility to support, that shows that you have respect for the family, and they're more likely to allow you to be there for them. And then we also work with linking them with other services and suspending our biases. So that just gives you a little bit into the life of what it is no, let me take that back. It gives you a look at how we approach peer support. We call our service that we do authentic peer support because it's based on a peer-based relationship. Because if the peer supporter has not created a peer-based relationship with that peer, then none of the work that we're going to do with them is going to be effective from our perspective as peer supporters. So, did you want to add anything else to that, Yolanda, about Pearls or the parent journey?
I think that you got it.
I nailed it. Thank you.
Yes, ma'am.
All right. So just to give you a little overview of what we've done so far in our first quarter of this fiscal year, we've hosted 4 community service events. We've had 111 contacts. We have 1 non-treatment plan client. Our non-treatment plan clients are people who just reach out to us for support. It could be, I need you to go to a meeting with me, or can you give me information about A, B, C, and D? And then we had taken in 7 new referrals. That's not including the families that we rolled over from the year before. This is all new for this fiscal year. We have, and I didn't put the number of referrals that we have on here, but our referrals have increased significantly, and our numbers are looking pretty. I'm excited about how good our numbers are looking for this coming quarter. So I wanted to share that with you as to where we are right now in our service delivery. So Yolanda going to tell you a little bit about what we do on a statewide level. She's going to start it off, and then I'm going to close it out. And then if you have any questions, you'll be able to ask any.
Okay, our statewide trainings are every 4th of the month, and the monthly trainings are designed to support providers, peer supporters, family resource developers, parents to bridge the gap between the families and the providers. Some of these trainings are used to do that, to provide some useful information to better serve families in our communities and across the state. The trainings are based on lived experience and evidence-based practices based off of what we know as families, that we know as peers, and as parents raising our own children. And some of the trainings that we have had are how to support parents transitioning back to school. So we wanted to give parents information on, the kids have been out of school for a year, and we wanted to be able to help support parents sending their children back to school. Some useful tips, things that can help kind of break the ice and get the kids prepared and help the families feel safe for returning back to school. How to support your staff through COVID-19 using considerations with trauma-informed care. How to support Black people with mental health. That's a big thing. We don't really like to recognize that we have mental health, and we don't feel that people get it. So how to relate to families like that if you're working with families that are of color. We do family-driven care and family leadership. We did a training on best practices to self-advocacy, skill building, and why youth self-advocacy is important. And I think that was one of the trainings that we did, that our youth peer supporters did for some youth. So those are some of the things that we do in our monthly statewide training.
Okay. So what I want to wrap up with is just to tell you about the work that we do on a statewide level. We have a grant through SAMHSA, and that allows us to do work outside of the county, which is really exciting for us. You just don't know how proud I am to represent Champaign County and Central Illinois when we come to the table as a family voice. And when we're coming to the table, we're sitting at the table where policies are being decided. We're sitting at the table where funding is being decided on how to be utilized and disseminated for children's mental health. So one of the first areas I want to talk to you about is the Illinois Children's Healthcare Foundation. The foundation was established in 2002 by Jim Ryan, the previous Attorney General. And it was $125 million was established to create this private foundation. And so I've been on the board of the foundation since 2019. And so they sought me out as a board member because I come to the table with that lived experience. They wanted to have someone at the table with that voice who can say, I've navigated these systems. When we're looking at, I sit on the grants committee. So when I'm looking at requests for proposals that we send out across the state, they want to know, is this going to be impactful and helpful for parents? They want to have someone who's accessed these types of services, who have worked with families directly who are utilizing these services and supports. Does this RFP, is it representative of systems of care, family driven, youth guided, all of those good, sound, evidence-based practices that are critical to providing good care for families? And so I've been a part of this foundation once again since 2019. We've given out over $30 million worth of grant funding since the inception. And I think last year alone in 2020, in response to the COVID, I believe we did about $20 million of grant making responses just to the issues around COVID alone. And so this is a critical place for us to be able to be a part of, because we are sitting at the table helping to make decisions about how funding is being rolled out for children's mental health in the state of Illinois from a private foundation. Also, this year I was appointed by the governor's office to be a part of the Illinois Children's Mental Health Partnership. And what's interesting about the partnership is that in 2003, the General Assembly passed the Children's Mental Health Act of 2003. And the partnership was created in order to develop a children's mental health plan that would be a strategic roadmap for the entire state with short-term and long-term recommendations about creating a comprehensive, coordinated mental health system, prevention and early intervention system in Illinois. And at that time, it was up to the age of 18. And so the first time in 15 years, we have come back to the table as a partnership with the state of Illinois to develop a new children's mental health plan. And this plan is being developed by 4 different work groups. The 4 groups are the treatment groups, the prevention, early intervention, and I can't remember what the other one, social determinants of health. And so I was asked to be a co-chair for the treatment work group, along with Dr. John Walkup. He is one of the directors of Lurie's Children's Hospital in Chicago. He is my co-chair. And I was able to advocate to get folks from our community to be on that working group. And so I invited Karen Sims to be a part of that work group, as well as for Lynn Canfield to be a part of that as well. So that's our work that we are doing at the partnership. And I'm really excited about what we're doing right now and pulling together the new mental health plan with the new recommendations that'll be coming out. And I'll be happy to share that. Maybe we could do something together as a presentation to bring back to the board to share about what the outcome was of that once we're complete with that work. Another thing that I do on a national level is that I'm a part of FREDLA, which is a national level organization that represent and advocate for family-run organizations. Youth and Family Peer Support Alliance is a family-run organization. That's an organization that's governed by 51% of people who have lived experience. And so we keep our members nationwide current and up to date on various policy issues and best practices. And right now I serve as the vice president of that organization. And being a part of FREDLA was really exciting because that gave me an opportunity to begin to learn more about the children's mental health movement outside of what was happening in Illinois, learn about the significance of peer support and its role in providing care for parents and for families and how critical it is. I just learned a lot, and it gave me an opportunity to deliver presentations and speaking engagements on a national level through various conferences nationwide. So these last two are really important because this is impacting us right now. Back in 2011, a class action suit was filed against the state of Illinois on behalf of Medicaid eligible children under the age of 21 who were not receiving the appropriate care as far as mental health. It's the early and periodic screening diagnostic treatment requirements of the Medicaid Act. And so this, they were sued in this class action suit. And what ended up happening was the state was required to develop a behavioral health delivery model out of this class action suit, which was called the MNB lawsuit. And in 2019, there was an agreement between the two parties, and in it was the actual implementation plan was put together and approved in 2019. So we've been rolling out, developing this new program that the state will be rolling out next year called Pathways to Success. I can't even go into what all of that is, but in the presentation, I put the links to all of these different organizations and sites so that you can see them for yourselves and to look at them. And so what's exciting about this is that when this lawsuit came to fruition and play, because I'm on the subcommittee and I've been advocating, as have people over the years been advocating, but Champaign County played a really big part in advocating for peer support to become a Medicaid billable service. And with this lawsuit and the consent decree and the rolling out of Pathways to Success, peer parent support will now be a Medicaid billable service come next year. So that is like super, super, super exciting. And we have been a part of that happening in our state because by the grace of God, I've been at the table to be able to say, hey, we need to do this. So that is phenomenal. So with that being said, this is the most exciting part is that I am a consultant with PATH, which is the Provider Assistance and Training Hub at the University of Illinois. The state hired me as a consultant, a subject matter expert, and I have been working with PATH since April of this year, side by side with the design team, developing the state's first mandatory credentialed peer parent support training program. And so all of that came from Access, Sustainability Program, Birthing Youth and Family Peer Support Alliance. And we are here today just doing whatever we can on behalf of families. So this is exciting because the Family Peer Support curriculum program will go live in January of 2022. That's it.
Thank you very much. A lot. Any questions or comments? Matthew?
I have a question.
Matthew had his hand raised. Go ahead.
Yeah, I just had a question. I'm really interested about the parent journey and kind of I'm curious, I don't think you mentioned it, but what kind of a rate would you say of people who come to you initially as clients, then kind of end up becoming fully trained peer supporters? Kind of what is that?
What do you mean? How fast does that happen?
No, not how fast. Just like what if you had a percentage, like what kind of, because I figured how fast would be completely dependent upon the person itself. But
so there really isn't. I don't have an idea because, like you said, every family is different. I can tell you probably out of the parents that we have served over the last 6 years, I would say at least 20% of those parents could potentially have been peer supporters, but because we don't have the funding to be able to take on that type of workforce, we don't know, right? But I will say that this is a developing workforce that is critical and very, it's going to need a lot of people to fill these positions. So at this point, we don't really know. The state has no idea of what it's going to take to rev up to get parents in these roles. So we'll see. But I would say at least 20% of the families we've served over the years could have been peer supporters. One of our first peer supporters, outside of those who came with me from Access, was actually one of our parents that we had worked with, and she was phenomenal.
So we do
our
currently
parents. Yeah.
currently have people in our work, on our staff that I have personally supported that is now working for us. So we do, so the staff that we have now is people that have received services from us.
Right.
Thank you. So who was the other person that had a question? Was that Daphne? Okay, go ahead, Daphne.
My question is, when the peer support person becomes more of a provider, I guess it's a two-pronged question. Does that, when you become a provider rather than a peer, because you're paid for your services, what liability does that confer on the peers / provider? And does that change the relationship and nature of how the person receiving the support views the peer / provider?
So so when an organization hires a peer supporter, it's just like hiring anyone else on their staff. They just have a different role. That has been oftentimes one of the biggest challenges of bringing a peer supporter or a parent professional into organizations, is because of the way organizations have been structured, that it doesn't allow for they don't want that personal relationship type situation the way that it is. But it doesn't impact their role in any organization. They're just like any other employee, right? And it doesn't impact their relationship as a peer. So it's actually very natural and organic. There was times when I was still parenting my daughter and going, the director of an organization, and providing peer support, training people nationally, and Yolanda is at IP meetings with me, supporting me as my peer. It doesn't change the dynamics of the relationship, because she's bringing, I'm there as a parent, she's being there as my support. It doesn't change in that moment. Yolanda, you want to make a comment on that?
I just want to add that when a parent becomes a peer supporter, we don't consider ourselves as providers. That's not part of our language and our culture. We're supporters. We are peer supporters. So we're not a provider. A provider does a different type of service than a supporter. We just provide support to families. And so when we get a parent that is now a peer supporter, that parent is trained in the same training that we have, the PEARLS training, our evidence-based training, to support the family the way that person is supported, which is really good, because that parent is still sort of fresh in their journey. And so they're still connected to their story, which makes them great to be a peer supporter, because like my children are all adults now. And so I'm not all the way removed from my story, but I still can relate to peers, because I have went through things with my children. But sometimes when your children are a certain age, things change. But when we get new people in, they're still connected. So they're very fresh in their journey, and that's good for the people that they're going to be supporting.
Right.
Thank you. I hear that. And, my daughter has, overdosed, and, we've been through the whole going to the ER, waiting for the crisis team, trying to find a hospital bed, these kinds of things. And so, I just wonder if this is going to be a reimbursable service I mean, and you have to be credentialed, do you become like mandated reporters and then it's not necessarily a peer thing? I'm just, that's kind of my question. And, can you be sued because maybe you don't give the right advice or something like that? Because that might deter people to volunteer. And that's just my question. That's all. And I thank you very much.
Yeah, we are all mandated reporters. So if, I'm just going to be honest. If I walk into a house and I smell weed, I'm not calling the police. But if I walk in the house and you smack your kid down on the floor, I'm going to have to report that, right? Because I don't know if your weed is legal or illegal, but I know if you smack your kid, I have to report that. But because our role are not considered, they are professional, because you definitely have to be trained. We require all the onboarding, any other agency required for families, and we have a standardized training and everything. And so when Regina was talking about the path, that's part of the stuff that has been being pushed so that people can be paid. We get paid to do what we do. If we hire somebody right now today, we have paid them for what they do. The only difference is it's just not Medicaid billable at this time, but people will still get paid for their role. Oftentimes when you have families who have children with mental health or behavioral concerns, it's really hard for them to maintain a steady job because they're being called a lot to come to the school or come get their kid, or, something's going on. But with a job like we have, you have the flexibility to, because we understand, we get it. We've been there. Hey, I got to take off and go get my child. Something has occurred at the school. So you're not being penalized for being a parent and you still able to work. So the way we provide our support is very different than traditional supports.
Thank you.
And we don't want people.
Thank you.
I'm sorry, one more thing, Daphne. I don't mean to cut off. We don't want people to do this for free. We want people to get paid to do this because they bring something to the table that other people cannot bring. They bring lived experience. They bring their knowledge around parenting children that require care above normal children. That is payable. A lot of times when I can sit in a meeting, if I hear somebody say mom too many times, I start to kind of cringe. And it's not too much longer that I say, please, address them as Mrs. whomever, Miss Janine or Miss Candy or Miss whatever, and not mom, because she's important just as much as everybody else is at the table.
I understand. Thank you so much for your explanation.
You're
I
welcome.
appreciate it. And thank you for your hard work.
You're welcome. Thank you. Thank you for your questions.
Have any other questions or comments? Go, John.
Well, I'd just like to thank, Regina and Yolanda for the work that you are doing. It's, truly incredible what you've been able to accomplish over the years. I was wondering, what do you feel like is some of the reasons that what are some of the reasons that have allowed you to grow the program in such a, I guess a rapid way compared to other programs? What are the things that you think you're doing right that we can learn from, that we can improve, and in other organizations in the community? I was just wondering what your thoughts were.
You know what, to be honest with you, it was just the timing was perfect. When access was winding down, choices came in. It gave us a platform to develop our service array around peer support. And at the same time, I started doing work on the national level, which gave me access to learning more about how to, what other family-run organizations who have been doing this for 50, 60 years,
Right.
I can learn from them on how to develop our organization and our services and support. And when choices came to Champaign County, and I'm not sure if everyone is familiar with it, but it was a 4-county project. The state actually paid for us to be trained how to train peer supporters. So this happened, 4 4 or 5
About
years
4
ago.
years ago.
Yeah, so this started like so the state began to invest in us early on. So that helped a whole lot. So we were doing things at the state level. We had that support. Then we have the support of, Champaign County Mental Health Board, and it just all like came together. But also people are beginning to see the benefit of having peer supporters because it's cost effective. It helps people who oftentimes have peer supporters engage in services longer or will try new services. It's effective because we're the boots on the ground, where a therapist might be be able to see you once a week for an hour. We can see you 2 or 3 times a week for however many hours you need based upon your need. And so we are able to move from system to system. We're not tied to any one particular system. We are not confined to an office. We do no office visits. We meet people in the community. So it's really based upon what makes this great is that we listen to the families of what their needs are and we meet them where they are.
Thank you. I mean, I really appreciate it. I mean, that kind of flexibility is hard to develop in an organization, and here you are and you've developed it, and it's truly amazing. Thank you.
Thank you.
And, I guess I would like to, if possible, encourage anybody who can encourage county board members to listen to this presentation, which is recorded, should do so. Because part of the answer to John's question is it's not the whole, it's by far not the whole story. The story are these individual people here and their tremendous work. But this mental health board went through a whole lot of arguments and dissatisfaction and upsets from previous county boards about its creation of this access program, which actually was the source for much of this work to begin. The whole idea was to create a community-based infrastructure. And of course, we had no idea how to do it. But the fact that we got that intentional activity going created incredible dissension from so many county board members. It's amazing to me that they could have been so negative about it. So what I would love now is if we could get existing county board members to take a look at this and see what happens when they put some faith and trust and resources behind real community people. Thank you. My unpaid political announcement.
Thank you, Julian. Yes, this is something that it works. I mean, I think one of the things that we do know sometimes is grassroots programs work, but my concern is, yes, Regina, you get to move on to a larger audience statewide, or you get to move. How do we keep maintaining this organization so that when you move along or when that this has staying power? Because this is something that we seem to have in the community. We have a lot of novel ideas, but when the leaders leave, the program goes away. So you training people to take over?
Absolutely. I was actually just talking to my daughter. She was like, Mom, when are you going to retire? I'm like, first of all, I'm nowhere near retirement age. But no, we do have my desire is for this organization to continue on long after I retire, and training the next exec ED to come along. It's even though it's a grassroots organization, I believe it'll be a grassroots organization that will stay. That's what I learned from being a part of Fretlo, like I was sharing with you about being a part of that particular organization. It talks, I'm learning about how to plan for the future for the organization. And so that's one of the benefits of being a part of that particular community, because once again, our family-run organization, we're actually, and I don't know if you all know this, but we are the only family-run organization that's recognized by the federal government in the state of Illinois. And once again, that's because we were of the sustainability plan. I mean, to Julian's point of what he said is that I get so excited about what came out of then. It was tumultuous. It was very difficult during that time, but some good stuff really came out of it. What Chandra is doing in her work with cultural competency, what Tracy is doing with the coalition, what Karen is doing with all of the trauma work, and little old us, you know, what we're doing with our work around peer support. But out of the initiative was birthed this ability for us to be able to be the leaders in the state of establishing the credentialed mandatory training for all peer supporters throughout all of the Medicaid billable services in the state of Illinois. That is monumental. And so because of the type of person I am, I'm not gonna let it die. It's got to go on because like I feel very passionate about this work. I really, really am. I could probably get up and do a jig right now, but I won't.
I'll put a song in. You're gonna live forever. Okay. Let's see. Do we have any other questions or comments? Go ahead, Lynn.
Only if board members have no other comments.
Okay. Board members? We're good? Okay. So, go ahead.
So I just wanted to thank you all for this last bit, especially. So first for indulging me in really pushing for these presentations, because I have wanted you all to hear from these extremely talented women for so long. And thank you so much for presenting. I know a couple of folks had to leave early, but this is just, it's just really important work to me. And it does go back to some times where we didn't realize, you know, that this was system transformation work. The Access Initiative was 6 years plus 3 years of sustainability. And here we are 3 years out from that. And maybe it did transform the systems. And I think one person that we should probably credit with a whole lot of vision there is Peter Tracy, who really hung in there. The application for that SAMHSA cooperative agreement went in 3 times before it was approved. And he was a major driver of that. So yay, Peter Tracy. And then the other comment I want to make was how much fun it was a couple years ago to be a moderator at a national conference where we were talking about systems of care. And one of the presenters dropped Regina Kreider's name.
Name drop.
Wow.
Yeah, so your work reaches really far.
Thank you.
Yeah.
So, thank you for presenting. Thank you very much. Let's keep the work going. Keep it in not just in our community, but spread the word. Thank you. Any board announcements?
One, it's not exactly an announcement, it's a question.
Okay.
Do we intend to continue having board members attend other boards in the community projects that we fund? Because I had been attending Rosecrans, but they changed their meeting times and I no longer can go. So I just wanted people to know that that's a kind of worthwhile meeting to go to because it's a community board and they give you lots of information about what they're doing. And I feel I'm regretful that I can no longer make those meetings, and there are probably other boards that we ought to think, but we used to do this in a systematic way, which we seem to have stopped. So maybe it's just a question for a future agenda, asking whether or not we want to begin doing that again.
It is part of a longer conversation that we will have as a board, and Lynn and I were talking about it, and it's going to be on the docket. So if there are no other board announcements, someone move to adjourn.
So moved.
All in favor?
Aye.
Hey, have a wonderful rest of the evening, and I'll see you in a couple of weeks or so. Okay.
Good night.
Night.